We are all very focused on empowering our patients to be able to have a voice in their own healthcare, but there is also the aspect of empowering the patient movement so that we have that collective voice and we can speak more loudly together. I think that there are lots of examples where IAPO has been playing that kind of empowerment role. It's helping to educate us and give us the tools that we need to be able to do the work. And certainly one of the examples around that would be around universal health coverage, about patient safety, so issues where there are cross-cutting issues, no matter what disease you're working in, where we can really get behind key messages and calls to action that will help all of our patients.
Empowerment entails enabling individuals to take control of their health, well-being, and lives. It is critical for improving health outcomes, quality of life, patient satisfaction, and reduction of harm or patient safety enhancement. And the patients must be able to ask questions, ask treatment options, treatment plans, and express their views if they are not confident with the treatment which they are being given or the service which they are being given.
Empowerment is the drive from being passive to being an active partner in one's own care. Nobody like patients knows what it means to live with a condition, especially a chronic condition, to go to work, to have to deal with family responsibilities, while at the same time you have to deal with a specific condition.
It's about what you do, how you live, to have this self-esteem and this confidence in yourself. That must go, of course, hand in hand with sufficient knowledge and sufficient skills.
For a bigger organization or an umbrella organization, empowerment also means capacitating everyone, every member, every leader, to be able to engage and communicate effectively with policymakers and with other stakeholders in pushing their advocacy work.
Women haven't been encouraged to speak out about these issues, so they need the information, they need to have the confidence to do it, and also they need the backing of patient organisations. Actually, we need a lot more of that.
There are lots of different size organisations within IAPO, some that are really, really small, and they feel like they need to have the help to feel empowered to do what they need to do. And that might not just be representing their community, but it could also be politically lobbying in terms of trying to enforce change where they're living, in terms of access to medicine, in terms of access to care. And having a support system like IAPO there helps empower them to do that.
With IAPO's support, we have conducted advisory sessions to educate communities about their healthcare rights and taught them effective mechanism for complaints and protection. Additionally, we are influencing primary health care by advocating for patient councils and empowering them in their daily work to strengthen the system.
The empowerment will support patients to have more voice, and their voice will echo and speak louder for the policy maker, so that the patient will also have more support to their needs.
Undoubtedly, patients must take a leading role in advocating for their needs and their interests. And in this sense, as all of us as patient organizations, we have a very strong commitment and responsibility to accompany them on this journey.
Empowerment means giving tone, pitch, volume to that voice, such that that person can be heard. So when you empower patients, they can now be heard. They now have the confidence to be heard. They are no longer stigmatized. They now become champions and even experts. And the end point is that the outcome of patient care will definitely go through the roof and be so well improved. And that's what IAPO is doing.